Hello, everyone. I'm Jim McIntyre, Communications Director for the American Red Cross of Northern Ohio. You know, it's been just over a year since the first diagnosed case of the 2019 novel coronavirus was diagnosed in the US. And although vaccines have been developed and are being deployed as we speak, it's going to take quite some time to vaccinate everyone in America. The virus is still infecting people, making people sick, and in some cases, worse. But we know that COVID-19 survivors are needed to donate their plasma to help patients who are still battling the virus. Convalescent plasma. It's a type of blood donation collected from COVID-19 survivors that have antibodies that may help patients who are actively fighting the virus. Debbie Grinstein donated her plasma, the former board chair for what was the Lake to River chapter of the Red Cross based in Youngstown, now a member of the board of the new Greater Akron and the Mahoning Valley chapter, rolled up her sleeve and donated her plasma on January 15th. And she's here today to talk about that experience. Debbie, thank you for joining us.
Hi, Jim. Nice to see you.
What was it that motivated you to donate your plasma after recovering from COVID-19?
Well, I've been a longtime supporter of the Red Cross, both with blood donation and on the board. And I just thought, you know, if I got this far and I was lucky enough to get through my COVID experience without too much of a trouble, I can also roll up my sleeve and do this. And I encourage others to do it as well.
When were you diagnosed with COVID-19, Debbie?
Well, it would be, I think, December 12th. I had a slight fever the day before, and I just said, you know, I'm not going to be the one to deny this. Something's not right. And I went and got a quick test and a long test, and they were both positive, to my surprise, because by the next day when I did get the test, I had no more symptoms. I was very lucky. I had a fever for a few hours and then it was away. But again, I didn't want to be the one that says, oh, there's nothing wrong with me. I wanted to make sure. And luckily, I did not infect anyone else that I had been around over that past week and a half.
That's very lucky, because I know people were asymptomatic sometimes and not knowing they had the virus were infecting other people.
Yeah.
You being a member of the board in the Greater Akron and the Mahoning Valley chapter, you knew that convalescent plasma could help people who are battling COVID, didn't you?
Yes, I did. And part of our mission is to get that word out. I think the Red Cross has done a pretty good job with that, with their ads. And I noticed them over the past year on the Red Cross ads. But it's not so easy. You know, I live in Youngstown, and I did have to go to Akron to do this. But, you know, I took the time to do it. Thankfully, I had the time that I could do that.
There is a page on our website. It's called Plasma for COVID. If you have recovered from COVID-19, fully recovered and feel healthy, you can go to redcrossblood.org/plasma for COVID and go through the process Debbie did in order to make an appointment to donate your convalescent plasma. And it can really help someone who is ill and suffering from the virus. One of the COVID-19 patients who received a convalescent plasma transfusion is George Sortino of Sortino Management and Development Company in Sandusky. And we're lucky enough to have George join us here today as well. You consider yourself pretty lucky, don't you, George?
Very lucky.
Tell us about your COVID experience, George.
Well, I was very ill in July, early July, and to the point that I could hardly breathe, and I knew something was wrong. So I called my son and told him to get his frame over here and take me to the hospital. They checked me in at Farland's Hospital, the local hospital here. They ran the test, and I was tested positive, and I went through about 3 weeks. I was 2 weeks in intensive care, and I believe I was the first one to receive that convalescent plasma, and that certainly made the difference in my recovery. So I encourage everyone get tested and too early, because the earlier the better. Yeah.
I read in the newsletter for Firelands Hospital, where you were hospitalized and treated, that you were in a bad way.
I was saying my prayers. I was negotiating. And, a precious thing called air, you take it for granted so much, and all of a sudden my whole world was upside down. And of course, you think of your loved ones, but when they started with giving me the treatment with the plasma, there was some hope, So that so I'm here today because of that. I really truly believe that, and I always joke around. I told the good doctors that thank goodness Jesus is Italian and he's one of me.
You mentioned that this happened in July, and convalescent plasma really was a relatively new treatment for people suffering from COVID-19. How did you find out about convalescent plasma, or was it just your doctor who suggested that you take it?
No, there's two people. Well, one is my daughter-in-law. She's a nurse in Chicago, and she worked for a doctor with that, and she recommended it. And I believe our former president took it or talked about it, so I was aware of that. And I didn't have anything to lose, so we give it a shot. And Dr. Avendano is the one that was chasing it down for me, and I was fortunate enough to get it, and I'm here today to live by it. So I certainly encourage everyone, because I want to pass it forward, and it's a great gift of life that I have, and the best exercise for your heart is to make a friend today and save a life tomorrow. So I want to share that with everyone, and I'm grateful to be here.
Unfortunately, George, you're not the only person who has had to have a convalescent plasma transfusion, but fortunately, the people like Debbie Grinstein who've donated their plasma continue to do so and help people like you, and a nurse named Amanda.
I knew I had corona. We had a patient that was super sick, and I triaged him. I had on all my coverings except for my eye shield. And that's the infectious disease doctors said that's how I contracted it. And it was 5 days later. It was on a Monday. I got up to go to work. I just had a little hacky cough. Honestly, at that point, it never crossed my mind that that's what it was. Got up Tuesday morning, regular time, felt okay, and went on into work. And by lunch, it just went downhill very fast. Everything happened very fast after that. So I got up Sunday morning. The shortness of breath was tenfold. And I went into the kitchen, and my husband was in there. And I just looked at him, and I said, in my bones, I know I need to go. What's a better word? I felt impending doom. The time I was in ICU, I don't remember much. I was in there for a week. The plasma gave my body the boost that it needed to fight COVID. If I knew the person who gave me that, oh, wow. Sorry. It's hard not to get emotional. How do you say thank you to someone who saved your life? I would say to someone who's on the fence about donating that it is literally life or death. You have the most precious gift to be able to give someone a second chance at life. And what are you waiting for?
My guess is, George, you can relate to that.
Oh, absolutely. Very emotional. that interview touched me because it brought back memories of my experience, and I'm glad she's here to tell the story. And I certainly encourage all people to pass it forward.
Debbie, hearing stories like George's and Amanda's, how emotional it is for folks who had COVID-19 and were able to recover thanks to convalescent plasma. How does that make you feel as a donor?
Well, it makes me feel good. I want to cry too. That was very touching. Just, I can, it takes 54 days between blood donations, but with convalescent plasma, you can go every week up to 8 times, I believe. And I plan on going back at the end of February for a second donation. So
a great point you make, Debbie. Yes. Normally, a whole blood donation would have to go 56 days apart. But for convalescent plasma, the need is so great, and the red blood cells and the platelets are put back into your body. So only the plasma is taken out. And yes, every 7 days, you're eligible to donate this plasma. Last month, the Red Cross distributed the greatest number of convalescent plasma products than at any other time during the pandemic. Hospital distributions increasing about 250% since October. That's how much people need this product. And we're asking those who have recovered from COVID-19 patients to roll up their sleeves like Debbie did and to make an appointment to donate at redcrossblood.org/plasma for COVID. But we're also asking for people to step up and volunteer to be blood donor ambassadors, to help register donors and guide them through the process. We also need volunteer drivers to deliver blood to local hospitals and to transport blood from local blood drives. So if you have it in your heart to donate, maybe you can't donate your blood, maybe for some reason it's not possible for you, you can volunteer at redcross.org/volunteer today. And it's not just blood donor ambassadors and blood transportation specialists, but also disaster action team members. And what do you know, Debbie Grinstein, you know all about being a blood or a disaster action team member, don't you?
Yes, I volunteer infrequently, but I am trained in disaster action. And actually, my first experience was actually a tornado. So I've had a lot of different experiences, none of them very normal, and not any one is normal because it's just tragic when you have to help victims who need to start their recovery. But yes, I have. And it's rewarding. Once COVID is over, it's a great time to be able to make people feel better because of what the Red Cross does and how it helps in those tragic situations.
We've had to make many adjustments at our blood donation centers and our blood drives. We've had to make sure that we're socially distanced, that we're hyper clean, that we're sanitizing after every donor, that everyone's temperature is taken and everyone's wearing a face covering. And in the field, when disaster action team members respond to home fires and other disasters, much of that response now is virtual. And if we can't reach people on a phone or a computer, and we do have to go to the site of a disaster, it's socially distanced, observing all the CDC protocols. So our first mission is to keep our volunteers and our staff and the people who need help safe and healthy. And that's what we're doing. And you are helping make people healthy when you donate your convalescent plasma at redcrossblood.org/plasma for COVID. So Debbie, we so appreciate what you've done. We're very happy that George is around to tell us about his experience having received convalescent plasma. And it's not just the plasma, but blood donations are needed constantly. blood is in constant need. It was true before the pandemic. It's true now during the pandemic, and it will be true after we've all been inoculated and COVID-19 is just a memory. Blood is in constant need.
We all admire the frontline workers and first responders for their life-saving work. You too can help save a life. The simple act of blood donation takes only about an hour of your time, but it can mean the difference between life and death for patients facing COVID, cancer, surgery, or trauma right now. In fact, every 2 seconds, someone in the U.S. needs blood. Please help a patient in need by making an appointment to donate blood. Go to redcrossblood.org today.
So once again, thank you all for telling your stories. Debbie, the donation process wasn't too painful, I assume?
No, it wasn't at all, actually. You can, I have small veins and the needles are smaller, so there was actually no pain. The phlebotomists were wonderful. And, you know, you get a treat at the end too. It takes about an hour to have the process. And it was painless.
George, how do you feel?
I feel great.
You look good,
George. I'm fortunate to be here. I'm focusing in on a better life with family and friends and trying to forget about yesterday. You know, I think this whole country's been suffering for over a year, cooped up in the houses, and it's been in my business world that I have a lot of employees and a lot of family, and but it's nice to see the encouragement. I see the governor now is starting to loosen up a little bit for us. We get to 11 o'clock, hopefully starting tomorrow. So, well, but I'm thankful for having this opportunity and to share with you, Jim and Debbie, and I look forward to meeting both of you.
Okay, George, thank you. It's a privilege to talk to you. And Debbie, thank you for your service to the American Red Cross. I'm Jim McIntyre, and we will talk to you again very soon. Thank you.